Hello, could you introduce yourself to us, please?
Yes, my name is Manuel Campos. I'm a third-year resident from Portugal, Porto, the north of Portugal. I'm presenting here a poster that's from a case of our department, a 45-year-old Caucasian man that was referred to our department with a history, a one-year history of a painful non-pruriginous erythema with erosion that involved all, as we see, circumference of the anus. It measured approximately 6 per 8 centimeters. The patient didn't have any relevant past medical history, and among this history in this physical examination, we considered as possible diagnosis infectious disease, pneumological disease, and also a neoplastic disease. Among the infectious and sexually transmitted diseases, we considered as the most probable causes of erosion of this perianal region, the infection by herpes, syphilis as the most common. So we did a laboratory test, and we also performed a skin biopsy. Serology was negative for syphilis, HIV, hepatitis C, and the patient presented a chronic inactive hepatitis B. Tumors markers were only a bit lightly elevated. The biopsy showed the presence of acanthosis, hyperkeratosis of the epidermis, and also presented with the medium to large size cells that had pagetoid migration. Upon this histology, the diagnosis of perianal Paget disease was made. Upon this diagnosis, and because of the fact that in a large percent of the cases there's an underlying neoplasm, we performed a digital rectal examination that was suspicious, and after that we ordered a flexible rectal sigmoidoscopy that confirmed the presence of a rectal mass. We did a complete staging of the disease with chest, total body CT, and also abdominal pelvic MRI that revealed the presence of ulcerated rectal mass and also periretal adenopathies. Upon this diagnosis and also the advanced stage of the disease, the patient was proposed for laparoscopic abdominal perineal resection and also neoadjuvant chemo and radiotherapy. The surgical specimen revealed the presence of an ulcerated mucinous adenocarcinoma with moderate differentiation that invaded all the layers and also had lymphatic invasion. The patient is now in follow-up in our department. He began a month ago adjuvant chemotherapy, and we will continue to follow the patient in our department with once a year biopsy of the skin around the excised lesions, and we will also perform a colonoscopy every 2 years. As a conclusion of this case report, this case illustrates the importance and also difficulties in the clinical diagnosis of this rare disease, perianal Paget's disease, and also as a take-home message, we would like to show that and tell that an erosionated perianal lesion resistant to a well-documented corticoid treatment should prompt the diagnosis of a neoplastic cause as perianal Paget disease or others.
Thank you very much.